Hi, everyone. I will share my screen. I am going to just do a brief introduction to the talk today and invite my co-presenters to introduce themselves. We will be discussing with you today one aspect of taking care of your health, and that is going for cancer screenings. Whoops. And we are hosting this talk today and presenting because it is, as you may or may not know, Cervical Health or Cervical Cancer Awareness Month. January is designated as Cervical Cancer Awareness Month, and cervical cancer is one of the screening exams that we'll be talking about later in the presentation. But first, I would love for the team to introduce themselves briefly, and I will call on people as they're listed here. Marissa.
Good morning. My name is Marissa Adams, and I am the project coordinator for the My Health, My Choice program. Thank you.
And we'll be talking to you a little bit more about My Health, My Choice later in the presentation. So you'll hear more about that. And I'm Julie Armin. I'm faculty at the University of Arizona and affiliated faculty with the Sonoran Center. I'm affiliated with the University of Arizona Cancer Center as well. And I will call on Veronica Boone.
Bene. Good morning. My name is Veronica Boone. I'm the Wellness Director for the Tucson Indian Center. I am Navajo and Laguna, but enrolled with the Navajo tribe. Thank you.
Thanks for joining us, Veronica. And Dana Russell is next.
Yes, good morning, everyone. My name is Dana Russell, and I'm the manager of what's known as HOPI Cancer Support Services. We're located in Kikotsmobile, Arizona, and our program primarily is involved with cancer screening, most notably breast and cervical cancer. Good to be here.
Thank you for joining us, Dana. And last but certainly not least, Heather Williamson.
Hi, everyone. My name is Heather Williamson, and I'm on faculty at Northern Arizona University.
So as I mentioned, the goal for us today is to just provide information and resources on cancer screenings that you all should be thinking about. And many of you will get these cancer screenings for yourself, as well as supporting others to get screened. I know there are there's a diverse group of people on the call today, and some of you may be more focused on getting others, on supporting others in cancer screening. And so we are all health educators here today. So we are providing some space after we talk about these cancer screenings for you to answer or to ask questions and share some thoughts. Really what we want to emphasize throughout this presentation is to talk to your doctor about these screenings. We can share basic information, but really your specific needs should be discussed with your doctor. So we do a lot of things to stay healthy. I'm sure all of you do things like eating healthy, eating fruits and vegetables, getting some physical activity, getting your vaccinations, including possibly the human papilloma virus vaccine, or HPV vaccine, which can help prevent cancer. And we'll talk a bit about HPV later in the talk. But today, as I mentioned, we'll be talking about cancer screenings. And first, I'll turn it over to Marissa, who will share some tools from My Health, My Choice with you.
Thank you. So today we're going to be talking about what cancer is and also the parts of your body that will be screened for cancer. And for some of you, this may be a new topic or one that is not easy to learn about or talk about. Therefore, we are going to do a relaxation exercise before we begin. So the most important thing about relaxing is remembering to breathe. So we will pretend to use a Kleenex tissue to practice breathing in a relaxed way. So take a moment now and pretend you are holding a tissue at the corner. Take this tissue and pretend it's a flower. Everybody sniff the flower nice and smooth. This is how we breathe in easily. Now blow on the tissue, nice and gentle. This is how we breathe out easily. To breathe in, we smell the flower, and to breathe out, we blow gently on the tissue. So everybody try that. And pay attention to how you feel as you breathe in and out. Awesome. Thank you for doing this with me. And if you ever need to calm yourself before an exam, you could use this relaxation while waiting in the waiting room or in the exam room. Thank you. By the end of this webinar, you will understand breast, cervical, prostate, and colorectal screening types, and understanding why it's important to get these cancer screenings. You will also identify where they can go for cancer screenings and apply tools for healthcare self-efficacy. What types of cancers have you heard of? And what is cancer? And some of you may even know someone who has had cancer. So cancer occurs when cells in your body change and become unhealthy and grow out of control. So let's think about a piece of corn. Each corn kernel is like a cell in your body. Here in the first picture, you see a healthy piece of corn. And in the second picture, a not so healthy piece of corn. When your cells are healthy, they look like a healthy piece of corn. And when a body has cancer, the cells are not healthy, like this unhealthy piece of corn. This is when those cancers can be found when parts of the body may have lumps that start growing and they won't stop growing. So breast and cervical cancer are serious, but can be treated if found early by a doctor. And you can tell by looking at someone that you can't tell, that you can't tell by looking at someone that they have cancer. Only a health provider or doctor can tell with some tests. So it's important for people to be screened for cancers. And we'll talk a little bit more about those cancer screenings today. Both men and women need to get cancer screenings to maintain and protect their health. Cancer screenings are exams that can find cancer before it causes symptoms and when cancer might be easier to treat. So the important thing is to remember that screening tests are done when you have no symptoms. Types of cancer screenings. We have a mammogram screen that screens the breast. We have a Pap test that screens for cervical cancer or cancer in the cervix. We also have a PSA test that screens for prostate cancer for males, and a colonoscopy or stool test that screens for colorectal cancers.
So thank you. I'll pick it up from here. My name's Veronica again. So on this page, we see that what we want to highlight and communicate is that it is so important to talk to your doctor about the need to get screened. And the sooner you initiate or have this conversation with your doctor, the better. The image that you see shows screening recommendations for getting one of the cancer screening tools, which is the mammogram. So everyone is unique, and it's really important to talk with your doctor about when the screening is right for you. So you could see that on on this picture that we don't have anyone, for example, from ages 18 or 19 to the age of 39. So in that instance, a woman with a family history should be screened and she should talk to her doctor. For the women ages 40 to 44, you can start to have a mammogram every year. But again, we stress the importance in talking with your doctor. For women between the ages of 45 to 54, it's recommended that a mammogram be done every year. Again, talk with your doctor. And for women ages 55 and older, the recommendation is for you and your doctor to decide to screen either every year or every 2 years. But again, stressing that importance in consulting and talking with your doctor. So you can see that all women should again talk with their doctor about when is the right time. What routine? Is it annually? Is it every 2 years? According to family history, symptoms, anything like that, any concerns that the woman might have, to really talk to your doctor. And again, mammograms are important for women of all ages. So on this next screen, we talk about what is it like to get a mammogram. So in order to get a mammogram, we need to take a picture of your breasts. So what they'll do is they'll put the breast in the mammogram machine, which then takes an X-ray picture. The mammogram machine, as you could see from the picture, will firmly squeeze your breast, and the healthcare worker will take an X-ray picture. The machine will then open up and release your breast after the picture is taken. We can think of this like a stress ball. So when you squeeze a stress ball with your hands, it'll go back to normal after the pressure or after you're done squeezing. And this is basically what happens when a woman gets a mammogram. And so what we have next is what you can expect when you get a mammogram with over at HOPI. So with that, we'll go into a video.
Good morning. In this video, I am going to show you what happens when you go to the mobile on-site mammography or MOM mobile to get a mammogram. A mammogram machine takes a picture of your breast to check for changes or abnormalities that could become cancer. When you arrive at HOPI Cancer Support Services Program Office, the mobile unit will be parked out front. Someone from the HOPI Cancer Support Services will greet you and assist you with completing all necessary paperwork before helping you onto the mobile unit. Here is what the mammogram machine looks like. In the MOM mobile, the healthcare worker will ask how you are doing and will explain how the machine will take X-ray pictures of your breast. She will be happy to answer any questions you have about the mammogram so you feel ready. She will then ask you to get ready for the mammogram. To get ready for the mammogram, you will need to remove some of your clothes. You will be in a private area to change your clothes. If you had used any type of lotion, deodorant, or powder on your breast, you will be asked to use the wipes to clean off the breast area and under your arms. The healthcare worker will leave you alone to get ready. You will need to take off your shirt and bra and then put on a paper cape with the opening to the front. The healthcare worker will return and move towards the mammogram machine. You will be asked to remove your left arm from the paper cape. Then the tech will assist you in placing the left breast onto the X-ray machine. You might feel uncomfortable with your breast in the mammogram machine, or when the tech has to touch your breast to assist you in proper placement onto the X-ray machine. You can use deep breathing to help you relax. You may be asked to take deep breath before the X-ray is taken. You will also be asked to stay very still. The healthcare worker will need to move behind the screen to start the X-ray. The healthcare worker will let you know when she is going to start the mammogram, and she may ask you to hold your breath. The mammogram machine will firmly squeeze your left breast, and the healthcare worker will take the x-ray picture. The machine will open up and release your left breast. The healthcare worker will come out from behind the screen and turn the mammogram machine around. The healthcare worker will then place your left breast back onto the machine. The healthcare worker will again move behind the screen to start the x-ray. The healthcare worker will take another x-ray picture of your left breast, but this time in a different position. The healthcare worker will then repeat the same process for the right breast. The healthcare worker will tell you when the mammogram is done. Then you will get dressed. The healthcare worker will tell you will get a letter in the mail with results in a few weeks. The healthcare worker will say goodbye and you can leave the mobile unit. A few weeks later, you get a letter letting you know the results of your tests. Thank you.
So now we'll talk a little bit about cervical cancer. And so cervical cancer is a disease where abnormal cells grow on the cervix. And you can see the cervix is just at the base of the uterus here at the top of the vagina. A Pap test, which some of you may have had, is something that can tell your healthcare provider if you have any changes to the cells in your cervix. And this is done during a pelvic exam. And it's generally recommended that people start getting tested for cervical cancer at age 21. Should start talking to your doctor about the test, and then get the Pap test every 3 years. And then as you age, the requirements change. So as Veronica mentioned, it's really important to just be aware of these screenings and what's recommended, and talk to your doctor about what's right for you. So the doctor can do a Pap test, which looks at the changes in the cells in the cervix. And they also might want to do an HPV test. So that is the human papillomavirus, which I mentioned to you earlier. Some of you may have gotten your human papillomavirus or HPV vaccination. Sometimes they test for HPV because HPV can be a cause of cervical cancer. So oftentimes when someone is 65, they stop doing Pap tests and testing for cervical cancer, but really it's important to talk to the doctor about that. And so we have a video that we put together, like the mammogram video that Veronica shared. This is a video that we put together with Tucson Indian Center about getting a Pap test.
In this video, I am going to walk you through what happens when you visit your healthcare provider to get a Pap test. A Pap test is a woman's health exam to screen for cervical cancer. When you arrive at your doctor's office, you will be greeted by a member of the health team who will take you to the exam room. Here is what the exam room looks like where you will get your cervical cancer screening done. Next, the healthcare worker will talk with you about how you are feeling. She will take notes about your health and show you pictures of where your cervix is in your body. Your cervix is inside of your body at the top of the vagina. The cervix is like a wall that separates the vagina from the uterus or the womb. It is about the size of a mini donut with a small opening in the center. She will then explain what will happen during the cervical cancer screening. She will be happy to answer any questions you have about the cervical cancer screening so you feel ready. She will then ask you to get ready for the test. To get ready for the cervical cancer screening, the provider will then ask you to undress from the waist down, removing pants and underwear. A gown will be provided and is used to cover yourself like a blanket. The healthcare worker will leave the room so you can get ready and will knock on the door to come back in when you are ready for the test. This is the exam table that you will be laying down on to get your cervical cancer screening. The healthcare worker will make sure that you are comfortable on the exam table. The back of the table will be moved so you can lay down. Next to the exam table, the provider will have a tray with the tools she needs to complete the test. The first test is the speculum. The tip of the speculum is what the provider inserts into the vagina to keep the vagina open so that the cervix can be seen clearly. During the test, the provider gently brushes the cervix to collect cells that will be looked at under the microscope. The purpose of this is to look for any abnormal cells and to help prevent cervical cancer. The test will also look for HPV. HPV is a human papilloma virus and is the main cause of cervical cancer. However, HPV is very common and not everyone who has HPV will go on to develop cervical cancer. This is why it is important to get your test to make sure the cervix is healthy. In order to see clearly, the speculum has a light. This black thing is a light that is connected to the bottom part of the speculum. It is the part of the speculum that the provider holds and does not get inserted into the vagina. Once a provider is able to fully visualize the cervix, that tiny little donut with a small opening in the center, she uses 2 different brushes to very gently brush the surface of the cervix as well as a small opening. In the red circle, this is a small packet of gel that is used on the speculum to help your healthcare provider gently insert it into your vagina. The red circle here shows one of the containers where your health provider puts the cells taken from your cervix. A third and final very little swab is inserted into the vagina and then placed back in the tube to send to the lab. This test is for gonorrhea and chlamydia, which are 2 sexually transmitted infections. The healthcare worker will give you a sheet to cover your lap. The healthcare worker will make sure you are ready for the test. Once you are ready, she will tell you that she is going to start the test. She will ask you to bend your knees and move your legs apart for the Pap test. During the Pap test, the healthcare worker will gently put the speculum inside your vagina to check your cervix. It may feel a little uncomfortable during the Pap test. The healthcare worker will tell you when she is done. Once you are done with the Pap test, the healthcare worker will leave the room so you can get off the exam table and get dressed. She will be sending your Pap test to the lab. She will tell you how to find out your test results once your results are back from the lab. You are all done. Someone from the healthcare staff will tell you how to exit and thank you for coming to get your Pap test.
So I was planning to turn it over to Dana, who I think may have dropped off the call, maybe having some technology challenges. Dana, are you there?
He just sent me a text. They lost internet
Oh,
office. So.
okay. Well, I will cover Dana's slides, not as well as Dana would, but and I was excited for Dana to talk about these slides because HOPI Cancer Support Services has recently been very focused on men's health. And I know they've been doing some outreach and education around prostate cancer screening. And this is a screening test that really requires that men talk to their doctors about the screening. and the recommendations for them, because it really depends on their risk for developing prostate cancer. And you can see in the image on the right that the prostate is kind of right behind the penis in the pelvic area. It's inside the body. And so because it's inside the body, the doctors often use what's called a prostate-specific antigen test, or a PSA test, which is a blood test, actually, to measure the level of PSA in someone's blood. And so the levels of PSA in someone's blood can be higher in men who have prostate cancer. But this is a screening that really, really requires that you ask your doctor, hey, do you think I should get this screening, and when should I start, and what should I think about? And then finally, the last screening we'll discuss is colorectal cancer screening. And you can see here in this body, and this is something that everyone should be screened for starting at age 45. You can see here in the body, the colon is highlighted here, and the rectum. So it's recommended, and these recommendations changed recently from age 50 to age 45. You really need to start getting screened for colorectal cancer at age 45. And talking to your doctor about the best time to start screening based on your own health. Importantly, colon cancer, like other cancers, often has no symptoms in the early stages, so you can catch it early when you do get screened. And there are two types of screening tests that could be done, and you can see on the right-hand side of the screen here, there are stool-based tests, this looks for blood in the stool. So it looks for blood in poop, and you can take a test at home every 1 to 3 years, depending on what your doctor tells you to do, and then you just mail it or return it to the clinic. If that test does a preliminary screen for anything abnormal, and then if that's positive, you would go on to have a colonoscopy, which is a visual test that looks directly at the colon, and it's generally done at a medical center. And what's cool about a colonoscopy is that it can actually prevent cancer from happening, because the doctor can remove polyps, which are like precancerous tissues, during the test. And that's something that I think the screening rates in the United States are not as high as they should be for colorectal cancer, but there's growing awareness about the importance.
Julie?
Oh, you're here.
Yes, it's Dana Russell. I'm sorry, we got cut off there, internet problems.
No, I'm glad you're back. Would you like to add anything?
No, I just want to tell you, I couldn't have done a better job myself. I will make a few other comments, and that
Yes.
is colorectal cancer is recognized as the second leading cause of death in the Native American population. So that alone indicates the importance of being screened as we all age, and it affects everybody. So it's important to understand and realize that. Go on to the next slide. Up here and in Tucson, that's the business we're in, information about these important screenings to our clients and people that visit our facilities. For the HOPI tribe, HOPI Cancer Support Services, located in Kikotsmovie, Arizona, is a resource where people can come and learn about about cancer and screenings and not apply to them. And as you can see, there's the telephone number that they can call. And I don't know how many of you are familiar with the area, but just get here to Kikotsmovie and somebody will direct you. And also Tucson we'll turn around and go into the urban environment. Tucson Indian Center, they're located on Stone Avenue, and there's a telephone number. And it's Veronica and her program that can provide education and information about cancer and cancer screenings. Okay, next slide. What I've just discussed has to do with education and information or actual testing for the HOPI tribe. You have the HOPI Healthcare Center. It's an IHS facility and it's located just down the road in Oaxaca, Arizona. Also, there's the Tuba City Regional Healthcare Corporation, of course, located in Tuba City. That's the business they're in, healthcare. So they're a resource. And Tucson area, we're talking about San Xavier Health Center in Tucson. Cells Indian Hospital is another resource. And El Rio Pascuayaki Health Center are resources to learn about cancer and cancer screening. Did I cover that right, Veronica?
Yes, you did. Thank you.
Okay. All right. Well, that's it. Now we go into the questions and thoughts area. Go ahead, Julie and Heather.
Well, we wanted to pause for a minute because we've given people a lot of information and just see if there were any questions. We have more content to share with you and some tools and resources. Lizzie, may I just call on people? I see Elise has a hand up.
Yes, please. Yeah.
Hi, good morning, afternoon. Almost. Dana, I heard you mention that cancer can affect a lot of the males in the native portion of it. I was wondering, is it more here also in, like, say for Arizona? I know they had the downwinders. Do you guys see that more here, like say for HOPI or like would some of those cancers be the cause of it? I should say,
Possibly for the downwinders, and that's for people who don't recognize that term. It's for people who develop cancer as a result of nuclear testing in Nevada during the 60s, primarily the 60s, who happened to live in an area which is identified in the Southwest. And if they develop certain types of cancer, then they're eligible for services through what's called the Downwinders program. Elise, I don't have any statistics as far as whether HOPIs are affected more or not, but I do know that we do refer people and help them with their application that they can submit to the program. And in our case, there's an office in Flagstaff that can accept applications and do follow-up.
Okay, thank you. I was just wondering only because I know that in the past I've heard they were a part of that when they found out they had either prostate cancer.
Yeah, what you'd have to do is look at the list of what they call eligible cancers to apply for, to get recognized for, and then it goes through the process.
Okay, thank you.
Good question, Elise. I just turned off, we do have more slides, but I turned off the sharing just while we're having this discussion, and then I'll share the slides again. And and at least I know there are some researchers at the U of A and NAU who are looking at environmental exposures and cancer. It's a growing area of interest for researchers. And then we have a question in the chat that from Suzanne about having concerns about bruising after a mammogram, and saying, I've asked for ultrasound instead and noticed nurses encouraging taking mammograms. However, Suzanne refused, and they would have to reschedule, or they try to persuade you to change your mind. Why is that? And Suzanne, I will start, and then perhaps Dana might have some insight on this. So I think it's great that you advocate for yourself to ask for ultrasound. And, you know, whenever you ask for something that's not part of the regular workflow for healthcare, there's often some challenge, insurance companies, et cetera. So I think what you've done is a great way to handle any concerns that you might have about a particular screening exam. And so I don't know, Dana, if at HOPI Cancer Support Services, if you've ever had people who request ultrasound or use ultrasound instead of a traditional mammogram.
To tell you the truth, I've never encountered a situation like that or know of it. But it doesn't mean that the question can't be posed,
Yeah.
probably to the clinicians and the people who bring out their mammogram units, and that would be the first step.
Yeah, thank you. Thanks for the comments and questions, everybody. I don't see any more questions in the chat or hands up, so I think I'll start sharing screen again and turn it over to Heather. And I anticipate there'll be some time at the end, and maybe we can answer any. One question. Louise, you asked about the visual test for colorectal cancer. And so a colonoscopy uses kind of a camera and a tube to scope, to look at your colon, and that's the visual test. So they actually use a camera, and they insert it into your rectum, and you get a little bit of a sedation just to relax yourself, and then they can actually look at the colon. So that's just one of those types of screening tests that you can do for colorectal cancer. And I don't know if others on other panelists have anything to add about that. Okay. All right, so I will share screen again. Okay.
Great, thank you. So everybody, hi again, my name is Heather. I'm from Northern Arizona University, and we're gonna give you just a couple of resources for self-advocacy, particularly related to health care and also cancer screenings. So next slide. So this is and we will, Julie's gonna put in the chat a link to this document, but we will also, after the presentation, make sure we share with everybody the slides and also these resources so you have them. So this is called the My Health Report. And this is a 2-page document that you can fill out. Right here, you're seeing the first page. And it's a really helpful way for you to be prepared to go talk to your provider for a visit. So it kind of helps you write things down or be prepared. Because, you know, I can get nervous when I go to see my doctor and I might forget to ask some things. And so this would be something that would be helpful to use. So you start out kind of letting them know about who you are. You know, obviously they want to know if you have any kind of disability that you'd like to let them know about, how you prefer to communicate with them. And then if you have a legal guardian and who they are. And then if you don't have a legal guardian, you may have someone else that you would like to have join you at that health visit and talk to you talk to the doctor and the health provider, as well as, about the reason you're there for your visit that day. So that's just letting them know who that person is and that you're okay with them being there for the visit. And then the next part tells them, so why are you there to see them? And so maybe you need just to have a checkup. Maybe you need to have a new medication filled. Maybe you're having some new issues, some new pains or problems you want them to know about. So you describe to them what's going on, when it started, and what you're doing to make it feel better or feel worse. And then the next section lets the health provider know what's happened since you've seen them last. Have you had any kind of medical visits? Maybe here is when you can let them know if you've had a cancer screening and how it went. You can also tell them how your overall health is. Is it about the same? Is it better or worse? And then also how you're feeling. It's important for your health provider to know about how you're feeling, your mental health. So are you feeling generally happy, sad, depressed, or anxious? And then finally, at the bottom here, you can see medications that you're taking to let them know. This could be a doctor that you've never seen before, or it could be a doctor you've seen, but it's good to let them know that here's the medications I'm taking, any kind of surgical history you've had, anything you've been hospitalized for, and if you've had any surgical procedures. And then the next page, this is the back page of it, kind of lets them a little bit more about you. And, as we all know, to be a healthy person involves all parts of your life. So it's, where you're living, if you're working, and how you're doing in general. So this lets them know more about you as a person. And so in the top left, you let them know about your daily life. So where do you live? Are you living at home? Are you living in a group home and other sort of facility? Who you live with, whether you've moved, if you're employed, and how you get around your community, and any changes you've had maybe in your mobility status. So how you're getting around your community. So that would let them know if you need some more supports in that area. And then you, on the top right, you let them know if you need any supports for daily activities. And then you also have a section here to talk to them or let them know about your sexual health. If that's something you want to talk to them about, this helps you kind of let them know that that's something you want them to have a discussion with you about. And then recently you have been, any changes, are you eating less or more, losing interest in things, feeling tired? And then the My Health Maintenance section, you'll see here, there's a whole section where you can write down for them. I'm going to highlight, because we're talking about cancer screenings, you can tell them if you've had your colonoscopy and if you've had a prostate exam, your mammogram or your pap smear. And so maybe you never have had those things, and maybe you're at that age where you should start talking to them about it, or you have a family history and you want to talk to them about it. And so that can kind of give you a chance to say, hey, let's talk about these things. I'm interested to know more about them, and if I need to go get those screenings done. And then lastly, just any additional comments you have. And then finally here, these are two resources we have actually from our My Health, My Choice program, which is a program that we are running right now that's primarily talking to Native American women with disabilities about mammograms and cervical cancer screening. So that's what these two examples show you, are these checklists. So this first is this kind of getting yourself ready to go for your mammogram. So, thinking about where you will need to go, and then how will you get to that? So will you need someone to give you a ride, arrange for transportation? And if you want someone to go with you, who is that person? Who is that person you want to come along with you? And then, to I think was it Susanna's point earlier, Suzanne, this is maybe where you start thinking about, maybe I don't want a traditional mammogram, maybe I want that ultrasound. So maybe I need to have that talk ahead of time and figure out if I can make it an ultrasound, not a mammogram, for that visit. And then on the day of the mammogram, Marissa went over some relaxation exercises with us earlier. So if you're going to be nervous, think about what things you can do to help you, with your feelings of being nervous. Write down any relaxation exercises you may want to use, and think about what you're going to wear. So, for the mammogram, you only have to remove your top. And so maybe you want to make sure that you're wearing pants and a top and things that are comfortable for you to change in and out of. And then what you're going to do after, you should definitely celebrate the fact that you went and got this done, do something nice for yourself. And then what's going to happen once you get the results. And then you'll see the cervical cancer screening checklist is very similar. One thing about this one that's unique from the mammogram that we ask people to think about is if you want to make sure you have a female provider to make sure that they know that that's something that you want, that you prefer to have a female provider doing that cervical cancer screening. That's important. And then, thinking about the person that you may want to have come with you, any questions you may have about going to get the screening, what's going to happen. And so very similar to the mammogram checklist, but just basically helping you think through all of the steps and the things that are going to help you feel comfortable and confident and ready to go get that cancer screening. And then this last slide here, and again, we'll send we'll give the website for those of you that can't access the QR code very easily, but we have a QR code here that takes you to the My Health, My Choice website. As I mentioned, we are currently providing this educational program for women with disabilities here in Arizona. It is, in the program, you can do it by Zoom, by phone, so from the comfort of your own home, and you learn about what it means to be a healthy woman. We talk about the different types, more in depth about what happens at a mammogram and more in depth about what happens at a cervical cancer screening, and then go through some more resources in more in depth and about being a healthcare self-advocate for yourself.